in our everyday lives, we're using technology for exchanges, to find an apartment, to rent elsewhere, the whole concept of Airbnb. And yet patients, in their ability to really find out about novel treatments or access to clinical trials and understanding that whole process is really a black box. There are currently some available sites like clinicaltrials.gov, but it's not very user-friendly and not very current with the social media climate. So I think a technology solution that really looked for utilizing the Airbnb type platform to create an exchange, if you will, based on where you live, what your preferences are, that helped you really see and tailor delivered opportunities for you to consider would be a big advantage for patients. One of the greatest barriers to the advances in medicine that impacts the well-being of patients with cancer or their prevention is really patients and their loved ones' knowledge about this whole realm of clinical trials. What does it mean, and how to make it a user-friendly concept so that it becomes as simple as thinking about going to the grocery store, and also the ability to really engage in the conversation and really feel as if someone's customizing this and making and thinking about you specifically and your needs and taking into account patient preferences.
One thing that I think could be helpful in terms of accruing to clinical trials is a way that a system could look at a doctor's schedule for the day and pick out certain patient characteristics and spit out a range of clinical trials that each patient might be eligible for. We frequently review new patients, but on a given day we'll see patients who are progressing on a current therapy that they're receiving, and that's a time point when they could be eligible for a number of clinical trials. So just to help us capture all the patients who might be eligible for trials, a better way to sort of search EPIC and match patients with clinical trials.
There's a lot we need to do in our communities, especially communities of colors, because we don't always get the best options also when it comes to cancer and treatments. They don't always look at going into the trials. We need to address those things. I think that's something that can also look at potential trials according to a given cancer would be interesting. We need a clearinghouse of what's going on around here in the country, not just in the country, maybe the world.
And we would have thought that we've solved that problem by having an internet site that just says all of the clinical trials. Somehow we haven't solved the problem. Clinicaltrials.gov is a complete compendia of every open clinical trial in America and many across the world. And yet still, if you ask a patient, hey, did you know that you had a clinical trial that was available to you that offers the same standard of care you got or you're about to get, plus something on top of that which might make it better, you know, it's a minority of patients that know about that. It's a minority, unfortunately, of community oncologists that even know about those things. And somehow, in the last 5 years, we see that if a thing is on the internet, it should be available and accessible to us. Somehow it's not still. Somehow when they put those internet things onto people's phones, now they're suddenly aware of them, even though they were already on the internet before. But I guess people don't want to sit down. They just want to walk and learn instead of sitting. So I suppose there's an opportunity for technology there to spread awareness of clinical trial opportunities for patients with newly diagnosed cancer, patients with relapsed and refractory cancer. This is the only thing that would move progress forward more quickly in clinical medicine for oncology and for other types of medicine as well.